So in this video, we will talk about the terminology or terms related to OMA. So as you know that in generally speaking that if any terms or terminology, it has the suffix OMA, so it is a benign tumor. So for example, we have adenoma. This is a benign tumor, adenoma. So you see the suffix OMA. Adenoma is a benign tumor. Or we have another tumor like papilloma. This is loma. Okay, you know this already, papilloma. Or we have meningioma. This is also the benign tumor. Or we have we have glioma or fibroma. So there are so many benign. It has the the suffix OMA and it is the benign tumor. But in this video, we don't talk about the terms related to the suffix OMA, but we will talk about the terminology. It has the suffix OMA, but it is not a benign tumor. So let's talk about that. So number one. So number one, we have hematoma. Hematoma. So what is hematoma? Then you see the suffix OMA. But hema means blood. Hema means blood. And OMA means grow. You know already OMA means grow. Okay, but it is not a benign tumor. So what it is? Hematoma is like this. For example, this is the blood vessel. You have the blood vessel. This is your blood vessel. So what happened due to some reason? For example, aneurysm. If the blood vessel develop a sac here, we call aneurysm. So due to some reasons, then this aneurysm is rupture. It is rupture or broken. Okay, and the blood come out. So when the blood come out and it will stick to or block, it will block at one place. Okay, and it make mass here. So this mass of the blood here, or we call that blood clot here. So this blood clot, it is not a benign tumor, and we call it hematoma. So hematoma is not a benign tumor. There. Second, next we have granuloma. So what is granuloma? Now you also see this OMA here, but it's not a benign tumor. So granule means gran. So what does it mean gran? For example, if the foreign bodies, okay, or foreign microbes enter your body, and your immune system or immune cells, what happened? Your immune cell will attack that foreign body, and then what happened? So for example, this is the foreign bodies, or we can say foreign agents or foreign microbes enter your body. So your immune system, especially immune cell, so your immune cell will attack this, especially macrophages. So macrophages will come and attack this, but it cannot digest this. So that's why what happened is will prison them. It will prison them. So it's cover them, prison them, and they keep the foreign bodies inside this. Okay, and outside is macrophages because it cannot digest it, and it will make mass here. For example, this is your skin. This is your skin, and here there's a mass develop here. Okay, inside is a foreign bodies, and then outside is a macrophages. This may also have the lymphocyte here, and this mass we call granuloma. granuloma. But this is not a benign tumor. Remember that? Not a benign tumor. So usually it's happen in the skin. Clear? So because it look like the gran. It look like the granuloma. So that's why we call granuloma. Then we have another one, line number 3. We have choristoma. Okay, what is choristoma? Chorist means separated. Separated. So what does it mean separated here? For example, this is your stomach. This is your stomach here. And this is the gastric mucosa. This wall, we call gastric mucosa. So what happens if the cell of the gastric mucosa, okay, it is a normal cell. I'm talking about the normal cell, okay, but it develop or is arranged in the normal pattern. It's arranged in normal pattern, but in the wrong place. For example, what does it mean wrong place? We remove here. I will remove here, and you see, you understand. For example, this is your intestine. This is your intestine, small intestine here. This is the small intestine. And this is the large intestine. Or you can say colon. This. So this is for example, here, this is the small intestine. And here, at the small intestine, we have, what we have here? We have macrodiverticulum here. What we have here? The sac here, like we call macro. So macrodiverticulum. So this sac is a macrodiverticulum on your where? On your small intestine. And then what happens if the cells of the gastric mucosa is developed here? Yeah, what happens? And it make mass here. It make mass here. This cell is a abnormal cell. I'm talking about abnormal cell, and they are arranging in abnormal pattern. But what happened in wrong place, wrong side? So what we call? So this mass we call choristoma, because why? It is separated from each place, and then it come here. Okay, normal cell in wrong place, so we call choristoma, and this is not the benign tumor. Clear? And then we have one more. I will remove here. We have one more. Number 4, we have hamartoma. So now hamartoma, this term is a controversy. It is a very controversy. What happened? So many people say that hamartoma is a benign tumor, but actually hamartoma is not a benign tumor. And then what happened? For example, this is your lung. Okay, so inside your lung, then there is a mass here. This is a normal cell, and develop in the normal place, means in right place, right side. But what happened? It is arranging, or they are arranging in abnormal pattern. They are arranging at normal patterns in right place, right side, but in abnormal pattern. So this we call hamartoma. And hamartoma is not a benign tumor. It is just a mass here. Okay. So now let's see. Okay, now let's recap. Now we have hamartoma. Hamartoma is not a benign tumor. It's come from the the blood clot at the outside the blood vessel. Okay, and granuloma is look like gran. Okay, that you know already. And we have choristoma and then hamartoma. So these terms, this terminology, it has the suffix OMA but it's not a benign tumor. Okay, I hope you understand. So thank you so much.